welcome to Healthy Chats with the Doc. Today we have Dr. Sydney Baker as a special guest with Dr. Brooke Leverone. Yes, very wonderful. So today we're going to talk about PCOS. And as women in the hormone space, I mean, this is an acronym that we hear so much about, but not everybody really knows what it means. So can we start out with what is PCOS?
Yeah. And, we were talking earlier about how PCOS is commonly this bucket that a lot of women get put in when they don't really know what's going on. It's sort of a diagnosis of exclusion where there's a bunch of things kind of going on and they don't really know. So they kind of put you into this bucket, but it's really it can be more complicated, but also can be a lot more simple than that. And not everybody is truly PCOS. And it's a bit of a spectrum. Wouldn't you agree?
Yeah, so it's a syndrome, right? It's not a disease. A syndrome means it's a collection of different symptoms, which can make it harder to diagnose, harder to recognize in the first place. Because amongst all of these different symptoms, this collection, you can have a spectrum of your severity of that symptom, excuse me. So it looks different for every patient that has come through the door that has been told they had PCOS or truly does. And it's, even within, the PCOS acronym, there is a breakdown and there's different types of PCOS driven by different imbalances in the body. So I think that's kind of why it is less information is out there and very concrete, because that's just not how it is. It's a collection of sort of random symptoms, and it's different for everyone according to how their presentation is.
Yeah. And it's really, there is like truly a spectrum. And I think that people get really intimidated and scared because they think that they get put in this PCOS box, and it means that they're on this far end of the spectrum with a very complex picture that is going to, ruin their life. And that's not the case, even if you are on the high end of the spectrum, but it can look like a lot of other things all the way down. And a lot of times it's not even PCOS. It's just, we need to balance some other things out, and the primary care maybe just didn't know what was going on, and so just labeled them as PCOS. So I think the take home there is it's a syndrome, it's not a disease, it's a collection of various symptoms, and it can present in various different ways. And it's important that you work with somebody who understands that, because it may not even be PCOS, and it can be really easy to manage when you know how to look at it. And there can be different ways to look at it. There can be different criteria to diagnose it. Again, which is why there's some confusion around it. But when you understand the pathophysiology behind it, it really can be something that we can work with from a functional perspective.
That's great. So PCOS, what does that acronym actually stand for?
That's a good question. We didn't say that. Yeah.
It stands for polycystic ovarian syndrome, which even
syndrome.
The name.
So you talk about it as a collection of symptoms. So what are some of the symptoms that so someone might think that, wow, maybe I do have PCOS?
So there's a long list of symptoms, and we'll go through those in a second. But in order to be diagnosed, you technically need 2 of the 3 following symptoms. So polycystic ovaries, which is looked at through an ultrasound. Elevated androgens or male hormones, which can be tested through blood test or just clinical. So elevated male hormones, you might have excessive hair growth, acne, more oily skin, starting to lose your hair in a more male pattern baldness scenario. So that one, the high androgens can be either clinical, which is more based on the symptoms, or biochemical, which is based on the blood test. And then the third requirement for diagnosis is irregular or missed period. So you don't even technically have to have the polycystic ovaries. If you have the elevated male hormones and the irregular periods, you got 2 of the 3 boxes checked and you're diagnosed.
And you can have cysts on your ovaries and not have polycystic ovarian syndrome. And I think that that's important because a lot of people are like, oh, you have cysts on your ovaries, you have PCOS. And that's not the definitive way that we diagnose that. You can have cysts without having PCOS.
So, I mean, one of the things we do obviously together a lot is hormone replacement therapy and hormone balancing, or the hormone symphony. Does PCOS relate to hormones? Because it sounds like, is there like more male hormones than female hormones, or just the processing of the symphony together there?
I mean, it's both. And this is what's challenging, is that the syndrome is a collection of symptoms, as we mentioned, and it affects every area of the hormone wheel. You know, we always talk about the hormones kind of being on this wheel together, dictating the ebb and flow of the body. And if somebody falls off the wheel, everything gets a little bit shaky. Well, in PCOS, there's typically multiple components that are out of alignment. Blood sugar and insulin levels are out of alignment. We get LH surges from the brain, which causes the high androgens. We have adrenal dysfunction. So there is a hormonal imbalance that is taking place, but it's multifactorial. And again, that can present in different ways depending on the patient. It may just be that they're prone to androgen production. It may be that they have insulin resistance, which is causing adrenal dysfunction that's leading to androgen dysfunction. And so the goal is to kind of figure out where is that imbalance on that patient's wheel to figure out what's going on. And as a result of the high androgens, women tend to be low in progesterone, which is part of why they can have irregular cycles and difficulty with fertility.
So let's talk a little bit about, is like with healthy aging. So I'm menopausal. So I have an age, but there's perimenopausal. Does PCOS have an age range to it?
It's typically more frequently diagnosed in women of reproductive age. So about 15 to 45, I typically see the most frequent diagnoses. And a lot of times it's because women are trying to get pregnant and they can't get pregnant. And so they go to the doctor and they have some of these symptoms and they're given the diagnosis of PCOS, which I see being very difficult on patients mentally and emotionally, because once, like Dr. Burke said, they're kind of lumped into this box of having PCOS, they have like this mental block where they think they're infertile. When in reality, we need to manage stress, decrease inflammation, and work on metabolic health, and those patients will get pregnant. So, typically it is in the reproductive age. Women can start as early as, right when puberty starts. But once you start to go through menopause, PCOS, if you had it, goes away because you're not having hormonal fluctuations anymore. So women who do suffer with PCOS throughout their reproductive age, they usually get relief in menopause.
So that's really interesting because, I know that you guys often help make babies from the doctor's point of view, but
yes,
so
we do like to get women pregnant here.
Yeah, you're not actually participating physically, but definitely supporting. So in supporting somebody who might have PCOS, so are there specific causes that you treat? How do you treat the root cause of PCOS, or like what kinds of ways would you help someone that has PCOS?
So there's kind of in the literature currently, there's 4 subsections of PCOS. So you can have PCOS that is basically related to high stress levels and coming from dysfunction of the adrenal glands. You can have PCOS that is more related to the high androgens, the high male hormones like we were talking about. You can also have PCOS that is related to more metabolic health, which Dr. Brooke was saying, kind of from the insulin resistance picture. And then there's a 4th type that is seen mostly in women who come off birth control because they've been suppressing their hormones for so long. And they're getting off the pill, they're not ovulating, so they're not having menstrual cycles. So there's 4 different types. And so really figuring out through a hormone blood test, which of those imbalances is the root cause of your specific PCOS syndrome is where you have to start, and it's different for everyone. So I would say over 50% of the PCOS cases that I see, working on the metabolic aspect, the insulin, the glucose regulation is kind of like the linchpin, and that's like where I want to start. But for some patients, if they're extremely stressed out and their cortisol and adrenals are the bigger picture, then we have to work on that. If someone's coming off the pill, we have to replete those nutrients and kind of get their body back into that cyclical hormone monthly cycle. So it's a little different. You kind of have to take the macroscopic view and look at those specific blood tests to be able to tell what you need to attack first.
Yeah. And with that, progesterone tends to be a really common tool for that, because they're often low in progesterone for those reasons that we mentioned, coming off birth control pill, high stress, being androgen dominant. And progesterone is a key component to regulating the cycles. And so with, fertility and irregular cycles, progesterone is another key component that will often be used when we're trying to get patients back on track with that.
Yeah, progesterone, that happy hormones, and
oh, I love
to help make babies.
Yep.
Yeah, so it's really fascinating. So obviously, when you talk about metabolic syndrome, functional medicine doctors like yourself are a lot like food is medicine, or like treating the whole person. So do diet and lifestyle have a direct effect on PCOS, or is it deeper than that?
I mean, diet and lifestyle has a direct effect on everything, obviously, but definitely PCOS. I mean, that's a huge component, when we're talking about metabolic health and insulin resistance, that you have to work on diet, you have to work on exercise, and the stress management piece of it, which we all need, but that is 100% a big part of that picture.
Oh, great. Well, again, we're nearing out of time, since we had a little slow start based on my
technical difficulties today. Yeah.
What's the last thing that I suppose you want people to know about? Hey, this could be PCOS if you're of an age, and don't worry, there's something we can do about it. So I guess what would be your parting words to women out there that might be suffering from PCOS?
I think just that there's hope. It's not a forever diagnosis. I think that you need to find someone who can look in depth at your stress hormones, your reproductive hormones, and your metabolic health, and try to work with you with diet and lifestyle, like we were saying, to sort of reverse some of these things that are happening, and to not go down the rabbit hole of Dr. Google, which can just make everything seem 100 times worse than it truly is. So finding someone who is knowledgeable about this, most likely a functional medicine doctor, who can help guide you on your path to recovery, and not being, labeled by the diagnosis.
Yeah, 100%.
Well, thank you so much. Sorry for the technical issues.
That's all right. We made it work.
We're back at it. So look forward to talking to you ladies next week. Have a great time.
I hope the rest of your day goes more smoothly. We'll talk soon.
All right, bye-bye.
Take care. Bye.